Good morning. This is Dr.R.Kamalambigeswari, Associate Professor from Department of Industrial Biotechnology. Now I'm going to present on the topic hypersensitivity from the course Immunology. First, we'll see the definition for hypersensitivity. Hypersensitivity refers to undesirable reactions which is produced by the normal immune system, which includes allergies as well as autoimmune disorders. Once the normal immune system produces, or once the normal immune system produces some undesirable reactions, which includes allergies or some autoimmune disorders, then of course it is said to be hypersensitivity. And these reactions, say allergy or autoimmune disorders, may be damaging or it may be uncomfortable, and sometimes it may be fatal also. Coming to the types of hypersensitivity, we have four different types. The type 1 is said to be immediate reaction, atopic and anaphylactic reactions. Type 2, it is going to be antibody dependent. Type 3, of course, it results in the formation of immune complexes. And type 4, it is cell mediated, or sometimes it is also said to be delayed type of hypersensitivity reactions. Coming to the type 1, which is said to be immediate or anaphylactic hypersensitivity, it is also known as anaphylactic hypersensitivity, and the reaction may involve skin, eyes, nasopharynx, bronchopulmonary tissues, and as well as sometimes gastrointestinal tract. Coming to the type 1, which is said to be immediate or anaphylactic hypersensitivity, it may cause a range of symptoms which results from minor inconveniences or sometimes to death also. Generally, these reactions takes about 15 to 30 minutes from the time of exposure to antigens, and sometimes it may be a delayed onset also. Say it may take 10 to 12 hours for the onset of symptoms. Coming to type 1 reaction, generally it is mediated by the antibody IgE. IgE, immunoglobulin E, mediates the type 1 anaphylactic reactions, which is specific to antigens. This IgE antibody, of course, these are specific to antigens, and the type 1 hypersensitivity is always mediated by IgE antibody. And the primary cellular component in this hypersensitivity is said to be mast cells, and sometimes the basophils are also involved. The reaction has been amplified by the presence of platelets, neutrophils, and eosinophils, which are the major cells in the blood. And the mast cells are stimulated, and while the mast cells are stimulated, they release a lot of histamines. Coming to the causes, the allergen are said to be the causes for this type 1 hypersensitivity reactions. And these allergens are non-parasite antigens that can stimulate the type 1 hypersensitivity response. These are some of the common allergens that are associated with type 1 hypersensitivity. Say some of the proteins like foreign serum or vaccines may sometimes cause type 1 hypersensitivity, may sometimes act as antigens, and hence they are said to be the causes for type 1 hypersensitivity. And sometimes the plant pollens may also act as antigens, and sometimes the drugs which are not, the individual will be sensitive to some of the drugs like penicillin, sulfonamides, local anesthetics, salicylates, and sometimes these drugs may also act as antigens. And sometimes the foods like nuts, seafoods, etc., may in turn act as antigen for some people, and hence that may cause type 1 hypersensitivity reactions in those people. And the insect products and mold spores the animal has may also act as allergens, which are the reasons for type 1 hypersensitivity reactions. Atopy, this is the general term, or this is the term which is used for the genetic trait to have a predisposition for localized anaphylaxis. Generally, the atopic individuals who are very sensitive who will develop the type 1 hypersensitivity reactions will have higher levels of IgE antibody in their circulation, and moreover, they will have some higher count of eosinophils compared to the normal individual. Coming to the mechanism of this type 1 hypersensitivity reactions, it is raised because of initial introduction of antigens, which produces an antibody response. As I told you earlier in the slide, this has been mediated by IgE, and hence the initial introduction of antigen in their immune system will in turn produce much higher level of IgE, which is the antibody that has been circulated in the blood and that results in the type 1 hypersensitivity reactions. And more specifically, the type of antigen and the way in which it is administered will induce the synthesis of IgE antibody in particular. Sometimes some antigens may be excreted as such. So the way in which the antigen is administered in the individual and the way in which the antigen encounters the individual will induce the elevation of this IgE antibody in the blood, which in turn makes the cause for hypersensitivity reactions, especially type 1. And this immunoglobulin IgE binds very specifically to the receptors on the surface of master cells, which remain circulating in the blood. And these mast cells are responsible for release of much higher level of histamine in the blood, which induces this hypersensitivity reactions. The reintroduced antigen will interact with IgE on the mast cells, causing the cells to degranulate itself, and during the degranulation of mast cells, the large amount of histamines will be released. Not only the histamines, the lipid mediators, the chemotactic factors will also be released during the degranulation of mast cells. And these large amount of histamines, the lipid mediators, and the chemotactic factors will in turn allow the smooth muscle cells to contract itself, and it will also result in a vasodilatation, and which increases, due to the vasodilation, the increased vascular permeability, the bronchoconstriction, and edema results. And these reactions occur very suddenly, which may cause death in the individual. And we'll see some of the mediators of type 1 hypersensitivity reactions. The main mediator includes histamine, then cytokines like tumor necrosis factor alpha, interleukin 1, interleukin 6, and the chemoattractants for neutrophils and eosinophils may also act as mediators of type 1 reactions. And the enzyme like tryptase, kinase, and cathepsin, and the changes in the connective tissue matrix. There may be some change in the connective tissue matrix, which may also lead to the tissue breakdown, which also said to be one of the mediator for type 1 hypersensitive reactions, and leukotrienes and prostaglandins. So these are some of the mediators which initiates or which is responsible for type 1 hypersensitive reactions. And here we'll see how the mast cells degranulates itself and how the mediators are released in the released outside the cell. So here we could find the mast cell, which has been in which the IgE antibody has been found on the peripheral surface, and the allergen has been linked to the IgE antibody. And while the allergen has been linked to the IgE antibody which was found on the mast cell degranulates, and during the degranulation of mast cells, many mediators are released like histamines and leukotrienes, which may act as an inducer, or which may lead to the type 1 hypersensitivity reactions in the individual. Coming to the diagnosis, how to diagnose whether the individual has been affected by type 1 hypersensitivity reactions. There might be so many tests, and the diagnostic test for immediate hypersensitivity includes skin prick and intradermal test, and measurement of total IgE, which is in circulation in the individual, and specific IgE antibodies can also be detected against the suspected allergens. And we can estimate the total IgE in the system and specific IgE antibodies, which are measured by the modification of enzyme immunoassay, especially ELISA. And the increased IgE levels are indicative of an atopic condition, although IgE may be elevated in some non-atopic diseases also, like myelomas. Coming to the treatment for this hypersensitivity reaction, the drugs, especially non-steroidal anti-inflammatories, are given, and antihistamines. These are the main drugs that are administered for type 1 hypersensitivity reactions, especially the antihistamines, since because the major amount of histamines has been released during the degranulation of mast cells. The antihistamines will block the histamine receptors, thereby the histamine thereby the histamine will be controlled, and the steroids also are given at certain circumstances, and theophylline or epinephrine. So these are some of the drugs that are administered in the individual who are suffering from type 1 hypersensitive reactions. Say the theophylline or epinephrine will prolong or increase the cyclic AMP levels in the mast cells, which inhibits the degranulation of mast cells. Next, the immunotherapy can also be given, like desensitization, which is also known as allergy shots, and repeated injections of allergens to reduce the IgE on mast cells and produce IgG. Next is about the type 2 hypersensitivity. So this type 2 hypersensitivity is also known as cytotoxic hypersensitivity, and this may affect a variety of organs and tissues. The antigens that are responsible for the type 2 hypersensitivity are normally endogenous, although some exogenous chemicals are also involved, as like haptens. Generally speaking, the antigens that are involved in type 2 hypersensitivity are endogenous in nature. That means they remain circulated in the blood. And these endogenous antigens can attach to cell membranes, and sometimes they may lead to type 2 hypersensitivity reactions. The example for this type 2 hypersensitivity is drug-induced hemolytic anemia, granulocytopenia, and thrombocytopenia. And penicillin allergies in some individuals also belong to this type of hypersensitivity, say type 2. And type 2 hypersensitivity, the reaction time is from minutes to hours. The type 2 hypersensitivity is primarily mediated by the antibody IgM or sometimes IgG classes. And here the complement, which are the set of serum proteins, are also involved in type 2 hypersensitivity reactions. And here the phagocytes, which are said to be the professional phagocytic cells, are also found to play a major role. And the lesion contains antibodies, complement, as well as the neutrophils. This hemolytic disease of newborn is a very known example for type 2 hypersensitivity reactions. This hemolytic disease of newborn is also known as Rh factor incompatibility disease. Here, the IgG antibodies are produced against the Rh positive antigens. Here, the IgG antibodies to Rh and Inococcus RBC antigens are produced, and this Rh plus baby born to Rh mother for the first time doesn't result in any problem. But once the mother is pregnant for the second time, and if Rh positive baby has been formed, then of course it leads to this hemolytic disease. So Rh plus baby born to Rh mother for the first time is fine, and second time can have also can have antibodies to Rh from first pregnancy, and hence what happens? These antibodies crosses the placenta, and baby kills its own RBCs. So it is possible to treat the mother with antibodies to Rh antigen right after the first delivery, and hence the mother may never makes its own immune response. So this is a representation what we have discussed in the last slide, where the Rh plus antibodies are generated, and how it crosses the mother placenta, and how it reaches the mother circulations. Coming to the diagnosis of this type 2 hypersensitivity, the test includes detection of circulating antibody, say especially IgM or IgG, against the tissues involved, and the presence of antibodies, as well as the complement in the lesion by means of immunofluorescence. So immunofluorescence, this is the technique where we type 2 hypersensitivity disorders has been detected. And the staining pattern is normally smooth and linear, such as that which is seen in good pastures nephritis. And the treatment also involves anti-inflammatory as well as some immunosuppressive drugs. Coming to the type 3 hypersensitivity reactions, here the type 3 hypersensitivity reactions are mediated by antigen antibody immune complexes. And here the IgG antibodies are involved, and hence it is said to be IgG mediated. And here a large amount of antigen and antibodies are formed, and hence they form a complex in the blood. And hence, once the individual has been affected by type 3 hypersensitivity, then of course large amount of antigen antibody complexes can be found in the blood. And if not eliminated, once this antigen antibody complex is not eliminated, then they can deposit in the capillaries of the infected individual. Whomever is suffering from type 3 hypersensitivity, and hence these antigen antibody complex can deposit in capillaries or sometimes in joints. And while the deposition of antigen antibody complexes has been triggered either in capillaries or in joints, then of course it leads to inflammations, which is a symptom of type 3 hypersensitivity reactions. Coming to the type of type 3 hypersensitivity reactions, it may be a general reaction like serum sickness, or it may involve individual organs like skin. Once the individual organs like skin are involved, then of course it leads to the diseases like systemic lupus erythematosus and arthus reactions, etc. And in kidneys, it may be resulting like lupus nephritis, and in legs it may result like aspergillosis, and in joints it is said to be rheumatoid arthritis, or it may affect any other organ also. So here we have to remember, like as I mentioned in the earlier slide, it is all formed due to the it all results due to the formation of antigen antibody complexes. And this reaction may be may be due to the pathogenic mechanism of diseases, which is caused by many microbes. In the type 3 hypersensitivity reaction may take 3 to 10 hours after exposure to the antigen, and this is mediated by soluble immune complexes, and they are mostly of the IgG class, although IgM may also be involved. Generally speaking, the IgG mediates the type 3 hypersensitivity reactions, and the reaction may in turn take 3 to 10 hours after exposure to the specific antigens. And sometimes, in some cases, the antibody like IgM may also be involved, and the antigen may be exogenous. So, in case of type 2 reactions, we have seen like the antigen is endogenous, but in case of type 3, the antigen may be exogenous, like chronic bacterial antigen, or sometimes the viral antigen, or sometimes the parasitic infections, the bacteria, the virus, or the parasites may act as antigen, which may induce the type 3 hypersensitivity reactions. And while the antigen concentration gets increased in the blood, it may lead to the formation of antigen antibody complex, which may result in type 3 hypersensitivity reactions. Or sometimes the endogenous antigens may also result in type 3 hypersensitivity reactions. And the non-organ specific autoimmunity disorders are some of the example for this example specific systemic lupus erythematosus. The antigen is soluble and of course not attached to the organ involved. So this is the characteristic feature of type 3 hypersensitivity reactions. And PMNS and the macrophages bind to the immune complex via the Fc receptors, and phagocytoses the complexes. But if unable to phagocytosis, then the immune complex can cause the inflammation via complement activation, like it leads to the activation of C3A, C4A, C5A, and then the frustrated phagocytes are in turn activated. Coming to the diagnosis of this type 3 hypersensitivity disorders, the diagnosis involves the examination of tissue biopsies for deposits of immunoglobulin and complement by immunofluorescence microscopy. So immunofluorescence microscopy is most important for the diagnosis of tissue biopsies, where we can find whether the antigen antibody complexes are deposited or the deposition of immunoglobulin is there, or else the deposition of complement is there. So for that, the immunofluorescence microscopy is necessary, and of course it is involved in diagnosis of type 3 hypersensitivity reactions. And the presence of immune complexes in the serum and depletion in the level of complement are also diagnosed. So whether the immunocomplexes like antigen antibody complexes are circulated in the serum, and the depletion in the level or the reduction in the level of complement are also diagnosed. So if the level of complement in the serum has been depleted or it has been reduced, and once the antigen antibody complexes are highly circulating in the serum, then that may also prove to be one of the symptom for type 3 hypersensitivity reactions. And generally the treatment includes the anti-inflammatory drugs. Next is about the type 4 hypersensitivity reactions. This is said to be the delayed type hypersensitivity reactions, or it is said to be cell-mediated hypersensitivity reactions. So the reaction includes here the sensitized T cells and release of its lymphokines as mediators, as well as the amplifiers. Once the sensitized once the T cells has been sensitized, then of course it release major of lymphokines, which is said to be the one of the mediator which induces the type 4 hypersensitivity reactions. And the mediator and the type 4 hypersensitivity reactions is being mediated by cells rather than by antibodies. So like type 3 or type 1, the type 4 which is said to be type 4 hypersensitivity reaction, which is said to be delayed type hypersensitivity or cell-mediated hypersensitivity, doesn't involve much of the antibodies. In turn, it involves the T cells, which is said to be the sensitized T cells, which results a major amount of lymphokines in this type of reaction, like type 4 hypersensitivity reactions. And the clinical stage of this reaction is said to include like contact dermatitis, transplant rejection, and granuloma. And coming to this type 4 hypersensitivity reactions, the Th1 cells release cytokines. The T helper cells, T helper 1 cells release major of cytokines to activate the macrophages, which in turn causes the inflammation as well as tissue damage. And the continued activation of macrophage can cause chronic inflammation, which results in tissue lesion, scarring, and granuloma formation. Once the macrophages are activated continuously, then of course these disorders like chronic inflammation results, which includes the lesions in the tissues and scarring of tissues, and moreover, it includes the formation of granulomas. Generally, the response starts after 48 to 72 hours of encounter of antigens, and hence it is said to be delayed type hypersensitivity also. And coming to delayed type hypersensitivity reactions, the type 4 hypersensitivity reactions, once the contact dermatitis occur, then of course it takes about 48 to 72 hours for the onset of symptoms, and the clinical appearance is like eczema. And coming to the histology, it affects lymphocytes and followed by macrophages and edema of epidermis. And coming to the antigen and its site, the epidermal like organic chemicals, poisons, heavy metals are said to be the important antigens that provokes these type 4 hypersensitivity reactions. And if you take the type tuberculin, then of course It takes about 48 to 72 hours for the onset of symptoms, and local induration is the clinical appearance. And it's coming to the histology, the lymphocytes, monocytes, and macrophages are affected, and it is intradermal. And coming to granuloma, it takes about 21 to 28 days for the reaction time, and hardening is the clinical appearance. And coming to the histology, the macrophages, epithelioid, and giant cells are said to be its histological feature. And coming to the antigen, the persistent antigen or foreign body presence is the antigenic side. Example is tuberculosis and leprosy. Coming to the treatment of type 4 hypersensitivity reactions, the diagnostic test in vivo includes delayed cutaneous reactions, and the in vitro test for this delayed type hypersensitivity include metagenic responses and lymphocytotoxicity, and the level of interleukin 2 production is also tested. And corticosteroids and other immunosuppressive agents are found to be the drugs which are used in treatment for type 4 hypersensitivity reactions. Transplantation. Uh, Transplantation, it is a transfer of living cells, tissues, and organs from one part of the body to another part, or from one individual to another individual. So this is said to be once the organ from one part of the body has been transferred to another part of the body, or else if one organ has been transferred from one individual to another individual, then of course it is said to be transplantation, and the organ is said to be graft, or it is said to be transplant. Coming to the necessity for transplantation, uh, many needs in humans has been satisfied because of this transplantation, and the damaged organs can be replaced, and non-functional organs can also be replaced by this transplantation process. And Alexis Carrel, he got the Nobel Prize in Physiology or Medicine for the work on vascular suture and the transplantation of blood vessels and organs in the year 1912. Coming to the definition for this transplantation, it is the implantation of non-self tissue into the body, and while the process of taking cells, tissues, or organs, which is said to be the graft, or sometimes it can also be called as transplant, from one part of the body to another part, or from one individual to another individual, and if it has been placed, then of course it is said to be transplant. And the donor is the one, or the donor is the individual who provides a graft, and the recipient or host is the individual who is going to receive the graft. Coming to the methods of transplantation, the two methods can be followed, like autografting and allografting. Autografting is the process where the organ or cells or tissues has been transplanted within the individual, and allograft, of course, it is between non-identical individuals, and if the organ has been transplanted from or in between species, then of course it is said to be xenograft. So it may take place between different parts of the same organism. If so, then of course it is said to be autografting. And it may be between organisms which falls among the same species. Then of course it is said to be allografting. Now, when it falls, or when the transplantation occurs between different species, then of course it is said to be xenografting. So autografting, allografting, and xenografting are said to be the methods of transplantation. Coming to the classification based on the genetics, the self to self is said to be autograft, and from one individual to another individual, then of course it is said to be isograft, which is said to be the which is said to take place between genetically similar individuals like identical twins, and the grafts between two genetically non-identical members of the same species are said to be allograft. Now, coming to the general information, the immune system rejection will be there sometimes in case of transplantation. Often a transplanted organ is not identified by the immune system as the tissue of the organism, obviously, since it has been transplanted from say if it occurs between species of the uh, between different species or else between the same species, and of course the immune system doesn't accept the transplanted organ as such, so it can be attacked or sometimes it can be destroyed also. Against this effect, the patient has to take immunosuppressive drugs, which may sometimes lead to the symptoms and sufferings like AIDS disease. And in 15 to 20 minutes, the organ dies, unable to withstand the immune system attacks. Coming to the allograft, the transplant from one individual to another individual with different genetic makeup within the same species may be there. Example, kidney transplant from one person to other individual, except except the identical twins.